www.patmacradiouk.co.uk, and then you will enjoy all the benefits that we provide. So, ladies and gentlemen, if you are listening to me, my name is Patrick, and then good evening, Doctor.
Okay, good evening, Patrick. Thank you for this opportunity.
Yeah.
Okay, I mean, this is a live show. It's a lovely show, and thank you for inviting me. Thank you for inviting me to talk about breast cancer. We won't just talk about we talk more about breast cancer, but we also touch on other aspects of health, like hypertension, diabetes, just for people to look after themselves and what to look out for. Okay, thank you for giving me this opportunity again. My name is Wasi. I've been a physician associate for 4 years now. I will just make it pretty straightforward to understand. So it will be something that we'll discuss, and people can then send their questions, and then we can take it from there. If anyone's got anything to ask, I can always, just I'll try my best to answer the questions as much as I can. So today we'll be talking about breast cancer. So we'll talk about what causes breast cancer, how to diagnose it, and what the treatments are, and how to prevent it. So the first thing, as you know, breast cancer is the most common type of cancer in the UK right now. And most women with breast cancer, unfortunately, over the age of 50, but younger women can also get the breast cancer. Okay, actually, about 1 in 8 women, will have breast cancer in their lifetime. Yes.
Real?
Yeah, according to research, yes, 1 in 8 women in their lifetime. So you can imagine 8 women in a park talking. According to research, 1 in 8 women out of those 8 women would have breast cancer in their lifetime. So the goal of this the show is to try and find how we can notice breast cancer, to prevent it, and what to do if you think that you might have a lump, or you suspect that you have something that might be breast cancer. Okay, so what causes breast cancer? So first of all, I would say the number one reason why people have breast cancer is because they can't control it. So it's genetics. Okay, so some people can have breast cancer because it's been passed down by a gene from their parents or their grandparents, and sometimes they can skip a gene. So if you find that in a family that someone's got breast cancer, the mother of that person might not have had it. It might have skipped a gene, but it's gone to the third person. Okay. So what happens is, if somebody's got breast cancer in the family, especially a woman, you need to find out about the family history of that person. And you will go to your GP or doctor, depending on where you're listening from, your physician, and they would do a test, which is called a BRCA1 gene test or BRCA2 gene test. And if that's positive, you can decide to then go on with treatments, or maybe removing your breast, removing your ovaries. Is something that you can talk about later on in the life. So that'll be a way of preventing that aspect of the gene. Okay. So if you also have sort of like what we call a fatty tissue, so if what we call a lumpy breast, there are some women that have quite a lot of lumps in their breasts. They're just benign breasts, which means it's not cancerous, but it can unfortunately sometimes lead to breast cancer. Okay. If you're also a smoker, obviously, if you smoke, you drink alcohol, you're not eating right, you're unhealthy, that can cause any sort of cancer anyways, but also it's one of the reasons why a woman can get breast cancer. Okay. And the fourth one is, unfortunately, as a woman, when you start having periods each month, we have hormones called estrogen and progesterone, which helps to regulate our body, and that's the reason why we have periods. But unfortunately, in some people, if they start the period early, it means that they're more, they have the estrogen hormone for a longer period of time in their lifetime. So as you can imagine, if somebody starts a period at the age of 11, and they continue to have that period until they're 60, it means that they've had estrogen all their lives, which means it can cause breast cancer, because a high level of estrogen can then cause breast cancer. But if you're pregnant in between, it stops the estrogen, you only produce progesterone, then you have that gap in between where you're no longer prone to, you no longer have estrogen in your body that can cause breast cancer. So gene, your lifestyle, you know, and then the hormones in women, which estrogen can cause breast cancer. Okay. So what are the symptoms of breast cancer? Okay. So you might have a change in your breast size. So if you suddenly notice that, oh, one of my breasts is bigger than the other one, even if it's not, even if you can't feel any lump in it. So you might have a change in your breast size. That's one of the you know, things that you need to be looked out for. If you can notice that there's a discharge, you're not breastfeeding, you're not pregnant, you've excluded all of that, and there's a discharge in the nipple. That's also one of the things you think about. Oh, this is quite weird, I need to go to my doctor. And the other one is what we call a skin dimpling. So if the nipple is dimpling, like if there's an indent in the nipple, instead of the nipple being a normal shape, but the shape is a little bit different, or if there's any redness, or number one, if there's any lumps in your breast. Okay, so the lumps that that's one needs to worry about is what we call a hard lump. So a lump that is fixed. So if you touch the lump, you can't move it around. It's fixed. It's fixed to the tissue. It's fixed to the skin. So that needs to obviously something that we need to worry about. Wow. And as I said, with age, family history, if there's a previous cancer in the family, and if unfortunately that,
Please, sorry for cutting you. You said something there that I wanted us to clarify. You said about one of the symptoms is the redness of the nipple.
Yes.
If you are black, how would you see the color change?
You will know, because it will look a bit darker than the actual. Just like when you have like a inflammation, or you have a wound or something, or you hurt yourself, or you burn yourself, there'll be inflammation or redness. You would know, because it would look a lot different, or would you say a lot darker than your actual skin color. And because it's not there, so anything that's never been in your breast before, let's just put it this way: if you've noticed something new in your breast that's never been there before, if it's changed color, if the nipple's changed, if there's a lump, and there's you know, it just doesn't look right, just go to your GP and, you know, let them have a look. You know, even if they say it's nothing to worry about, you know, it's best to just make sure that it's nothing to worry about, then there's something to worry about. Okay. Wow. So is there any questions?
Please, let's continue.
Okay. All right. So I'll just recap. Okay. Breast cancer, sometimes it happens, we don't know why. But most of the time it's caused by, you know, age, it's caused by genetics, and it's caused by, you know, the hormones in women, estrogen to be precise, which we can't control. Unfortunately, we have to have monthly periods, and the only way you can actually stop that gap is, you know, maybe if you're pregnant. So it's, you know, there's a myth that the more babies you have, the less likely you are to have breast cancer, because obviously you have that gap. You have that gap in between when you're not producing estrogen, and they do say that sometimes if you do want to go on contraception, it's best to like maybe try progesterone only contraception instead of taking a combined contraception, because that's then again it means you're adding more estrogen into your monthly hormonal regulation. Basically, that's just what it is.
Wow. Okay. Ladies and gentlemen, yes. I wanted to ask one question before you continue. Is it only women who can have breast cancer? Cannot men also have breast cancer?
Hey! Yes, men can also have breast cancer, unfortunately. Wow. It's very rare. It's very rare, but it does happen. So if a man notices a lump in his breast, you know, same thing, redness, abnormal breast shape, nipple discharge, you know, some, you know, the different, you know, it's something that doesn't, if it doesn't look right, just go to the doctor. They will still send you for a scan, and they will still send you for, you know, you will still be investigated, just the same way they will investigate a woman for a possible diagnosis of breast cancer, just to, you know. So yes, it can happen, but it obviously happens mostly in women because they have all those, you know, what I just discussed. Yeah,
Wow.
and the genes, and if they've had breast cancer before, unfortunately, they have to keep an eye out because it can happen if you have a lumpy breast. You know, a lot of tissues in your breast. You have to have a look at that. Make sure that it doesn't turn into a cancerous cell in the breast and things like that. And the only way to prevent it is finding out early. So if you find out early that something is wrong and you go to your doctor, I've heard a lot of people just say, you know, I don't think so. I think it's going to go away. It's just a small lump. I've had a lump before. It will go away. It's just a bit of infection. I'll take some antibiotics. It's nothing. You know, it's just, you know, it's a boil. You know, a lot of people say that and they just leave it for a very long time. Some people even try like herbal medication, you know, things that other people have tried. And unfortunately, if you leave it too late, you know, they might not be able to help you on the hand. So it's best to notice it early and try and investigate it and go to the GP straight away. So the best way to do that is to examine yourself. So every day when you have a wash, if you have your shower, you're having a bath, you examine yourself, you check every morning or whenever you can. Usually I would say do it at least 2-3 times a week. Make sure that you can't feel any lump. What I would normally do is just lay down on the bed, because when you lay on the bed, you'll be able to feel things better than when you're standing. Because obviously you might not be able to feel anything, but when you lay on the bed, you can just touch, you know, start from the top, then from the side, which is right next to the your armpit, and then underneath as well. And then you can also have what we call lymphadenopathy, which is like inflammation, or what we call a lymph node that can sometimes come out. So it can be anywhere. So if you've got a lymph node in your armpit, the back of your neck, and something isn't right, just go to the GP or your physician and they will investigate it. There are other signs that you need to, that one need to look out for as well, apart from the lump. Some women don't have any lump, but they have that swelling in their armpit. So if there's a lump or the swelling in the armpit, again, go to the GP to be investigated. Sometimes when the woman becomes really unwell because of breast cancer, they can have weight loss, they can have night sweats. It's a myth that the hair is falling out. Most of the time it doesn't. It's the chemotherapy that makes the hair fall out, not the actual not the actual cancer itself. Yes. So don't look at that for the first sign. So the first signs will be the lump, the swelling in the armpit, the weight loss, the night sweats, the loss of appetite, the sweating at night, you know, just waking up in a night sweating, chills, you know, suddenly feeling very tired and feverish, and just don't feel yourself. So those things will really, you know, they're what we call the B signs. So you should be speaking to your GP about it, really.
Wow.
Yeah, and then usually when they do find out there's breast cancer, there's so many things that they can do. So surgery, chemotherapy, radiotherapy, and things like that. But most times, if it's found early, it can actually be cured. You know, people do live a normal life, even with the diagnosis of breast cancer. That's if found early, but if it's left so late, sometimes there's nothing that can be done. So that's the reason why we have to make sure that we try and, you know, examine our breasts very often, you know, so that we prevent it if we do notice that there is something not quite right with the breast.
Wow.
Okay.
Ladies and gentlemen, everybody is at risk, men and women.
Yes.
We need to open our eyes to these things, because if you don't take care, if you don't find it out early, then I don't know how you're going to treat it. The doctor has spoken at length, and if you have any questions, you can forward it to me. Some people have been sending some motivation messages. I need the questions, please. You can send it to me on 0741 302 5596. And if you're listening to me, this is Live Train. My name is Patrick, and careful. I hear you. And Minister, I hear you. Thank you very much, Doctor. So now that we know all these things, and we know how things are going in our bodies, we are checking, how can we lower the chances of getting breast cancer?
The reason, if it's genetic, then the only way you can lower the chances is if you know that there's a family history or there's a strong history of a breast cancer, then you need to go to your GP. They can't refuse you and ask for these tests, this BRCA1 gene test. There's a BRCA1 gene test and there's a BRCA2 gene test.
BRCA1, BRCA2.
BRCA2. So if you go to your GP and just tell them that there's a family history of it, even if it's an aunt that's got a breast cancer, it doesn't have to be your mom. So it could be your aunt from your mom's side or from your dad's side, especially if that person has been tested for BRCA1 and BRCA2 gene and has been positive. So if somebody in the family has had cancer, for example, and they always do this test, BRCA1 and BRCA2 gene, and if it's positive, they will tell them to relate that to their family so that they can go to their GP for them to have the test as well. Okay. And if that's positive, it doesn't necessarily mean that that person that's done the test has got breast cancer. It just means that they have more chances of getting breast cancer. So if you remember Angelina Jolie, I don't know if anyone's heard the story, there are quite a lot of celebrities that they've got the BRCA1 and BRCA2 gene in their family, and they've just decided to have an hysterectomy where they take out their womb and they've cut out their breast. Okay. That's
so what is the correspondence between the breast and the womb?
Because if you have the BRCA1 and the BRCA2 gene, you're more likely also to have ovarian cancer. So apart from the breast cancer, you can have an ovarian cancer as well. So they just then decide to take out the womb, which is what we can do, total hysterectomy, and the breast tissue, unfortunately. So it's something that, and even now, what people can do if they decided not to go through that route, they can do a test yearly. So there's a test called a CEA test. It's a lab test that checks for breast cancer. It's sort of like something that becomes elevated if there's some sort of cancer going on. And there's another test called CA125 that's specific for ovarian cancer. So that's also done. That can be done yearly just to monitor that you're not going into that route. And then you can have a yearly mammogram as well. So if you don't want to go through that route, so there are things that can be done when you speak to your GP, you know, in terms of preventing getting breast cancer, if you know that you have that family issue of that BRCA1 and BRCA2 gene. And obviously, if you're a smoker, if you drink a lot of alcohol, if you don't have a good diet, if you don't have a good lifestyle, stopping that will also reduce your risk of getting any sort of cancer, not necessarily breast cancer, but any sort of cancer. And again, if you have a lumpy breast, like a lot of tissue in your breast, if you notice something isn't right, I promise you, it's only a 10-minute examination. And they will never turn you back because they know that you have more risk of getting breast cancer because you have a lumpy breast. So anytime you have a lumpy breast, if something isn't right, call your GP. They can talk to you on the phone and then bring you in for examination. And if they feel that it is a breast cancer, that's fine. If they feel something isn't right, they can send you for a routine ultrasound scan, and that will give you reassurance. Okay, so those are the main things that really should be done. Just lifestyle, breast exam. Just keep checking yourself weekly, examining yourself. If something isn't right, you know, go straight to your doctor.
If something isn't right, go straight to your doctor, ladies and gentlemen. I am with Dr. Wasi, a physician associate. She's a very powerful woman. She's talking to us about breast cancer, how to prevent breast cancer. She said a lot. If it is not genetic, if you are a smoker, if you are an alcoholic, well, if you drink alcohol, and then you need to take care of yourself. You need to go for the test. So, Dr. Wasi, should we be scared?
No, you shouldn't be scared. I don't know if everyone I'm speaking to is a Christian, but as a Christian, you have no reason to be scared. If you do all those things, you know, and take all those measures, you have no reason to be scared whatsoever. Just check yourself. Usually these things will tell you, your body will tell you. The first thing they will do is a blood test, and a blood test always flags up something. It always flags up something. So even if you don't have any tissue or any lump in your breast, or you're feeling tired, you're having night sweats, you're just not yourself, you're not doing the things that you usually do, your body will tell you, because you know that this isn't the way you used to be before. So just go to your GP. Simple blood tests will give you reassurance. Simple blood tests will let them know what they need to do next, and they would examine you as well. So there's no need to worry if you do those things. Does this be discussed? If that's done, then there's no need to worry.
So, doctor, let's talk about the treatment. Let's talk about the treatment of breast cancer. Does it have any side effect apart from the hair loss?
There's so many side effects. It depends on the stages as well. So it depends on how far the treatment, the cancer has spread. So they check if it's cancerous, then they let you know which stage it's in. And some people will have just surgery and chemotherapy, and some people have surgery, chemotherapy, and radiotherapy. There are different types of treatments, different type of treatment for breast cancer. It's not just the hair loss. Some people have like tiredness. Unfortunately, the symptoms you get when you have the breast cancer itself. So tiredness, weight loss, loss of appetite, you're more prone, because what they do is basically you don't have any immune system, because the chemotherapy drugs, they target all the cells in your body, whether good or bad. So you're more likely to catch so you're more likely to catch like fever, infection, common cold, flu, things like that. So those are basically the side effects. But it depends on the stage it is at the time that it was diagnosed.
Doctor, I have a question from Mr. Intiamwa from London. He wants you to go through the signs and symptoms of experiencing breast cancer again. If you can do that for us again, please.
Okay, so it will be the same thing. So if somebody's had the breast cancer before, so again, they could have tiredness. So if they're not taking any medication, because there's some people that have breast cancer and they give them medication for a very long time that can make them have symptoms of tiredness, just general fatigue, loss of appetite, and things like that. But if you're in remission, which means you've been told that you no longer have the cancerous cell and your normal cell. So the symptoms that you will be getting will be tiredness. The lump can come back sometimes, so you can feel the lump come back to side, the swelling in the armpit, the tiredness, the loss of appetite, night sweats, and weight loss. Night sweats and weight loss. Yes. Night sweats, weight loss, loss of appetite, those three symptoms, plus the lump, plus or minus the lump. So those are the symptoms that could occur if breast cancers come back, unfortunately.
Wow. Ladies and gentlemen, this is Live Train. My name is Patrick, and you are on PatMac Radio UK. This evening, we are sharing knowledge, and then we are talking about breast cancer. Mr. Richard Intiamwa is still asking, do men experience breast cancer? Yes, sir. According to doctor, men do experience breast cancer, but it is rare, according to doctor. So if you find any changes, if you discover any changes in your breast, if you realize that the breast is getting bigger, lumps are coming in, and it's like it's looking at the other side, you need to go for a check. Ladies and gentlemen, it pays to go for the check. Doctor, still on breast cancer, what advice will you give to my listeners? 1 in 8 women, this is serious. What advice will you give to my listeners?
The only advice I can give is you have to check your breast at least 2 to 3 times a week. Okay. Apparently, some people find that they have breast cancer incidentally. So some of them don't even have the symptoms. That's because it was probably the beginning of the cancer. So it's not gone too far that they would start having symptoms. So because some women are so used to checking their breasts and examining their breasts at least 2 to 3 times a week, they find a lump. So if you examine yourself, if you look after yourself, if you have a good lifestyle, and the lump is usually one of the that would be the first thing most times. Not all the time, like I said, it could be just a swelling in the armpit and feeling unwell. So just check your breast. That would be the number one advice. Always check, examine your breast 2 to 3 times a week. If you can do it every day, it will be great. But sometimes doing it too much can make you a little bit nervous, scared. You know, sometimes they say if you're looking for something, if you look for something too much, you'll find it.
You find it.
So, so just do it 2 to 3 times a week. That would be my advice. Examine your breast, examine.
Now, doctor, I heard that when you give your breast constant massage, it reduces the risk. Is that true?
No, I think that's a myth. Don't do that.
Because I believe that gave the men some work to do. You know.
No, don't do that. It's a myth. Just examine your breast for the purpose of making sure that there isn't anything there that isn't supposed to be there. That is it. Don't massage the breast. Because you could actually, there are tissues in the breast. You don't want to be massaging it too much and then causing inflammation and then causing something else. It's a myth. You shouldn't do that. You should just
Ladies and
examine.
gentlemen, did you hear that? It is a myth. Those who massage their breast like an orange, please take your time. Take your time, ladies and gentlemen. Dr. Wasi. Okay, so doctor, let's move on to our next topic: hypertension.
Yes.
What is hypertension?
Oh, hypertension in a layman's language is high blood pressure. Okay, it's just high blood pressure. Everyone knows high blood pressure. Some people know it as hypertension. It's just basically increasing your blood pressure that can cause things like stroke, you know, what we call myocardial infarction, which is like there's so many things that it could cause. It's very common in the Black community, unfortunately. It's very common. Yes, it's one of the most common reasons, common cause of death in the UK, hypertension.
Really?
Untreated, undiagnosed hypertension. Yes, it's one of the most common. So that's why I just thought we'll touch on that today.
Yeah.
As well. Yeah. So it could cause stroke or heart attack. Those are the two major things that it could cause. Because I can imagine if your blood pressure is high, and we have like arteries, ventricles, veins in our body, and the closest place from your heart is your brain. So if you think about it, hypertension, okay, you have high blood pressure, your heart's beating very fast, working really hard to pump out the blood in your heart. And if you work so hard, it can sometimes dislodge in the arteries and go to the brain, and that's the reason why it causes stroke when it blocks. I don't know how to explain it in a layman language, but hypertension is basically high blood pressure, okay, which can cause stroke or a heart attack. So, and it's very common in the Black community. Most people, for some reason, don't like to treat hypertension. They like to do it the natural way, which I don't know what that is. Some people like to use African remedies, African medication to treat hypertension. I've never heard of that. Yeah. So the best thing to do is to check your blood pressure. If you just buy a machine from a pharmacy, it's only about £30. You just check your blood pressure daily to make sure that you don't have hypertension. Cut out the salt, increase of salt in the food that we eat. Obviously, we eat quite a lot of stuff, a lot of carbohydrates. We have really bad diets.
Wow. So is it because of the Black community, because we have our food is mainly carbohydrate? That is why we. Oh,
yes.
Okay.
Yeah.
So that is the main cause.
Well, that's one of the main causes. One of the other reasons why we can get hypertension is because of genetics. So we don't know why, but apparently, as Black people, that's why there's a whole lot of medication that is targeted for only Black community. There are different medications. So, for example, if somebody gets hypertension, there's a specific drug that's given to Black people because that's the only one that would work. So
it's not because they want to kill us.
No, it's not because they want to kill you. It's not because they want to kill you, because that's the only one that would work. It's targeted for Black or Caribbean. There's the medication is very common. Amlodipine is given to Black community because that's the only medication that tends to work. Other medication will work, but this will work better in the Black community. So sometimes it's just genetic. It's just genetic. Most of the time is the food we eat, and you know, we have very unhealthy lifestyle. I'm sorry to say, we barely exercise. Some people barely exercise. I mean, we're all trying that, but you know, weight gain, bad diet, you know, not looking after ourselves, you know, lack of sleep, stress, you know, all those things can all cause hypertension, unfortunately. So
Wow.
the only way to treat it is to the most important way to treat it is just to have a very good lifestyle. It's very difficult, especially because we work, we have bills to pay, no one's got time to
So
you know,
when you say a good lifestyle, what is the medically approved definition of a good lifestyle?
eat good food. So have lots of veggies.
Not the
Reduce your
above.
sun. Not the about, not the, not the panda jam.
Jesus.
Yes, it's very difficult. Just cut out most of the carbohydrate food. Eat lots of protein. Cut out the salt. The salt is the most important thing in the food, because some of this food that we eat, especially like processed food, they have lots of salt in them. That's why they're processed, because they put plenty of salt and sugar in there. So we need to watch out for that. Cut out the salt. Do some exercise, daily exercise, at least 20 to 30 minutes. It's very difficult, but if we can have a very good lifestyle, that would also help.
Wow.
And if that doesn't work, take the medication. Take the medication if it doesn't work. If you can't exercise, if you can't cut out your salt, or you've done all of that, it doesn't work. Because some people, even with, that's what I'm saying, sometimes it's genetics. So even if they've got a good lifestyle, they're eating healthy, they're doing all the exercise, they'll still have high blood pressure. And the only thing that can help them is the medication that is offered to them, which they should take. If you're offered a medication for your high blood pressure, take it. So that'll be I know you're going to ask me my main advice. So
Your advice.
Medication, if you're offered, especially male, if in the male community, they've got this myth that the medication that has been given to them gives them low libido, which means they're not able to.
Yes, so it will not make you perform.
Exactly. So they don't take it. So would you rather have low libido or die? So you have to be one of those. Or would you rather have low libido or have a stroke? So just take the medication. If you're lucky enough to be able to get rid of the hypertension by doing lots of exercise, cutting out your salt, eating well, then that's great. But if you've done all of that and you're still not able to get your blood pressure, the normal blood pressure, by the way, depends on if you've got diabetes or if you've got any other health issue. So if you're normal, if you don't have any other problem, if you don't have a kidney problem, if you don't have diabetes, normal blood pressure is 140/80, not 120/80. It's 140/80. If you've got diabetes, it's 135/85. That's a normal blood pressure. So it depends on your underlying health condition. That's what determines what your normal blood pressure will be. So if you have a blood pressure of 140/80 and you're usually well and fit, then you don't really have a blood pressure. You just need to keep an eye on it. But if you have other health condition, then that's still high blood pressure, basically.
Wow.
Yeah.
Ladies and gentlemen, wow. This evening, if you are listening to us, you have any questions, 0741302556. If you are calling from outside the UK, do not forget to include the country code 0044. I don't think I'll be taking phone calls this evening, but you can send me a direct message or a WhatsApp message, and I would talk about it. We are talking about hypertension. Doctor, you have spoken about the possible health problems that is associated with blood pressure, the stroke, and then the other one. Are they the only health problems that you can associate with blood pressure?
Well, those are the main ones, but they're not the only health problem, because if you have hypertension, because you have a very bad diet, you eat a lot of salt, you eat a lot of sugar, you're more likely to develop diabetes, you're more likely to develop like kidney problems. If your blood isn't circulating well and it's not functioning well, it's your heart is beating too fast, you can develop a heart failure. So not just having a heart attack. Yes. because you're putting a lot of pressure on your heart because the blood is pumping too much. It's not pumping the way it's supposed to pump. So it's not just those two, but those two are the main ones. They're not the only reason why, they're not the only medical condition that you can have from hypertension. Get heart failure, diabetes, you name it, kidney problems, anything at all. Because it's just basically it's regarding the way the blood is pumping in your heart.
Okay, I have a question from Mr. Ntiamwa again. He is asking, is hypertension hereditary?
Yes, that was the first thing I said. You can get it. It can be genetic, so it can actually be passed on. And so it's just like a woman, a pregnant woman. When you go for your bookings, they will ask you, do you have any family issue of anything? Do you have any family issue of hypertension? If you say yes, they keep a close eye on you because hypertension can lead to what we call preeclampsia, which means you're more likely to also have it, and it can also be triggered by pregnancy. So it can be hereditary.
Oh,
yes.
Wow. Ladies and gentlemen, hypertension can be hereditary. Yes. And if you know that anyone in your family has had it before, watch out. And we need to hit the gym. We need to exercise. We need to cut the salt and the swallow, the food. We need to check it. We need to really check it. So, doctor, talking as a lay person, talking as a layman, who don't actually know how to use the blood pressure machine and who is always working, going up and down, what are some of the signs that I will see that will trigger blood pressure issues in my mind?
Sometimes there are no signs, actually. There are no signs, but some people, what they'll have is just migraines. They just continue to have migraines, especially people that don't usually have migraines before. They just have migraines. And that's the reason why when you call your GP and you say you have a migraine, the first thing they tell you, let's check your blood pressure. Have you checked your blood pressure? That's the first thing that they say. So those are one of the signs. Sometimes there isn't any sign at all. Sometimes you don't have any signs at all.
My God. So you would just be there, it would just hit you.
Exactly. But the most important one is the first thing that I know, that when we find out that somebody's got hypertension, incidentally, is when they call and they say, oh, I've been getting this migraine all the time, or I've been getting difficulty breathing. I feel very tired. But the first complaint is usually the migraine, like severe migraine. And then you tell them, oh, can we check your blood pressure? And you check it, it's like 180/10 or something, So yeah, it is quite a deadly disease, unfortunately, and it can be prevented with a very cheap medication if you're not able to.
That was where I was going to the treatment. How do you treat it?
You just take antihypertensive medication that would just reduce it. There are so many medications that be given. It depends on obviously the skin color, like I said. And it depends on the side effects as well, but you will usually be given like antihypertensive like amlodipine, which is what I will always advise the Black community to ask for, because sometimes you might be giving something like Ramipro, which is what they give to the other Caucasian community. Well, go for amlodipine. The side effects of that, you might have a bit of leg swelling, but if you don't have that, it usually works best. It's the best one. It's just medication that you'll be given. The first one is lifestyle, again, like I said. But if you're not able to obviously fulfill that, then go for the medication.
Wow. I have another question from Mrs. Apia, and she wants to ask, if you are put on medication, will you be on it forever or can stop when normalized?
Yes and no. Okay. So what happens is if you're taking medication, so the only problem with that is that some people take medication and they don't do the lifestyle changes. So if you're giving medication and you don't do the lifestyle changes, you're always going to have high blood pressure when you stop taking the medication. So never stop. But if you're taking the medication and you're eating well, you're doing the exercise, you've lost weight, because obesity is one of the reasons why people have high blood pressure, because you're just, when somebody is big, unfortunately, some people don't have it, again, like I said, because it's genetic. But if somebody's lost weight, they're doing the lifestyle, they're eating well, they're drinking plenty of water, and you've been taking it for at least 2 years, and you're still doing your lifestyle, we can take you off it or reduce the dose, and you continue. If you see that the blood pressure is normalized, you can be on the reduced dose for, maybe another year or so. And then if you still continue the lifestyle, you can then stop. But that will also be discussed with your own GP. So you can then stop. And then your blood pressure will then be monitored every 3 months, depending on what they do in your country, wherever you're listening from. It will then be monitored, and then that you can then totally stop if it carries on. Okay. But unfortunately, people become dependent on the medication. They don't do any lifestyle changes. They don't eat right. The medication is there to just help to prevent the hypertension. You can't stop, unfortunately, because if you stop, it will come back up again, and you have to go back on it again. But if you can do it yourself, because some people will say, okay, I'm going to do the lifestyle changes, but obviously my blood pressure is very high at the moment. We can start you on the medication. You can use that opportunity so you show that you're not at risk at that time. Because some people will say, oh, I'm scared. I don't want to, I've got kids, I don't want anything to happen. I just want to take the medication and then start, working out, eating well. If they're able to do that on their own, because you would know as well with the lifestyle changes, you take the medication, because most people, unfortunately, when you start medication or the antihypertensive, they're more likely to add another dose on top. We've noticed quite a lot of that because people just get relaxed. So if they're eating 2 plates of rice, they increase it to 4 because they have the medication now. So because of that, you then find out that people are now having to add more to their medication. Instead of having 1 medication, they're having 3 medication. But if they're on that 1 medication and they're managing it with their lifestyle, and you check the blood pressure, we check the blood pressure anyway every 6 months to yearly, the dip in the blood pressure would tell you that this person is working hard. You see what I mean? And then you can then reduce it at a time, because you don't really want to give them too many medications anyway. So if you're taking, for example, 10 milligram of amlodipine, and in a year's time, your blood pressure has gone from 140 to 100/70, that will be reduced to 5 milligrams. And then we'll come back again and check in the next 6 months. And if it's going even worse, we stop it, because your lifestyle is enough to make you stop the medication. So you can't stop it, depending on your lifestyle. But if you're not doing anything different, you can't. It's just the blood pressure, just the medication that's making the blood pressure normalize.
So the concerns that when you get on the blood pressure medication, you're going to be on it for life, because I've been hearing that from people that if you don't take care and then you get on the blood pressure medication, you will be on it for life. It's actually not true. If lifestyle
it's not true. It's your lifestyle is changed, because you every year before your medication, if you're in the UK, as far as I know, if you're on any medication, not even just blood pressure medication, you have to have a yearly blood, and you have to have your blood pressure checked every year.
Okay.
So if your blood pressure is reducing, then that's not good clinical practice to keep you on the same medication that you're taking. If you're taking 10 milligrams of medication and your blood pressure is gone, it's reducing drastically, you have to halve it. You can't stop it drastically. But eventually, if your lifestyle is, you can stop it, depending on your lifestyle. If you're managing it with your lifestyle, it can be stopped eventually. But I kid you not, Patrick, I haven't seen a lot of Africans that have managed to maintain their blood pressure with lifestyle changes. Tell me one, if I have one, if you can tell me one. So there is no way the medication is you're gonna be able to stop it. If you change your lifestyle, then yes, by all means, it will be stopped, because you'll be checked yearly. Instead, they add more and more and more and more and more to the medication just to.
So we have issues when it comes to lifestyle changes.
Exactly, we do. Even me, I do. The last time I exercised was like 3 months ago. It's very difficult. We're busy, It's a very busy. We're all busy. We have kids. We go to church. We go to work. Exactly. So we can't really blame we can't blame anyone. It's very difficult. So if we can do the lifestyle changes, then yes, yeah.
Interesting. Interesting.
Yeah.
So, doctor, before we leave this, I think our time is fast spent now, and
Yeah.
we may not be able to touch on the third
Diabetes.
topic, which is diabetes.
Yeah.
But I would give you a chance to just brush it, you know, for the benefit of my listeners, you know, with 1 or 2 minutes to just brush it. But before we go there, the medication of the blood pressure, apart from the leg swelling, is there any side effects that you can get out of it? Because people
it depends. It depends. You know, some people that take medication, they don't get any side effects at all. But like the most common one would be the leg swelling. Sometimes you might get a little bit of upset stomach, with just like every other medication that you even antibiotics can make you have upset stomach, like nausea, vomiting, dizziness. Because obviously you have the dizziness, because sometimes when the medication is given, it can reduce your blood pressure so drastically, and low blood pressure can cause dizziness. So that can also happen, and you can feel a little bit drowsy and headache. But most of the time, people don't really have those side effects. They would just complain of the leg swelling most of the time. And there isn't really much, in terms of side effects. But always read the leaflet, and obviously if you've got any concern, discuss with your doctor. If you notice any side effects that you think is to do with the medication, it can be changed. There are lots of medication that can be used to treat hypertension.
So, doctor, we have 7 minutes to come to the end of the show. Please, diabetes, can you just brush it for me, like 2-3 minutes?
Yeah. Okay. I mean, it's that on its own is a very big topic. So, and there are different types of diabetes. So some people don't know this. They think there's only one diabetes where they just take metformin for. Okay. So there are two types of diabetes. There's type 1 diabetes, which is when your insulin, the insulin isn't working at all. That's how I can explain it in layman language. And that's the reason why people that have type 1 diabetes have to be on insulin, because the insulin isn't working at all. Okay. And then there's type 2 diabetes, where your insulin isn't working enough. So you need medication to help with your insulin to break down sugar, basically, in the system. So it's a very big topic. Okay. So the only thing I can say about that is type 1 diabetes is mostly common in children. Just if a child is thin, if they're thirsty all the time, they're drinking a lot of water, and they're tired all the time. So they're the 3 T's: thirsty, tired, thin. Take them to the doctor. It could be type 1 diabetes. Also the same signs for adults. It could be tiredness.
So it can happen in children?
Yes, type 1 diabetes specifically for children is actually very common in children. So just if a child is thin, that's what I'm saying. It's a very broad topic where people don't actually know that there are different types and there are different ways and different things that causes it. It's all to do with insulin, but it's just how the insulin breaks down, and that's how they differentiate between the type 1 and type 2. Basically.
I think we must.
Well, the most common one.
Negotiate so that we deal with diabetes.
Yes. But the most common one is type 2 diabetes. Again, lifestyle changes can actually cure diabetes type 2. Yes, you're going to be very surprised about this. Lifestyle changes. Cut down the sugar and lose weight, and it will go. I've seen this several times. Cut down the sugar and it will go. If it doesn't go again, metformin is what will be given. It's a medication that can be given. This one is very dangerous, because if you don't treat diabetes, it can lead into something called diabetes ketoacidosis, or even death or coma. Okay? So anyone that's got that type 2 diabetes should take the medication straight away. This one is not the one that can be delayed or postponed. It needs to be treated immediately. The very best way to treat this, if you're big because of this, lose weight. If you're eating a lot of sugar, carbohydrates, cut them, and it will get rid of it. It will get rid of it.
So our fufu, pounded yam, and no or half.
No.
Hey,
no.
Oh.
If you want to cheat, maybe once a month. If you want to cheat, maybe once a month.
Once a month?
Yeah.
And what should we replace it with?
Oh, that's very easy. Lots of vegetables. Lots of vegetables. Yeah, that's very easy. Just eat lots of veg. Have lean meat. You know, you don't always have to have anything stewy or anything fufu or carbohydrates, because the bigger you get, the more likely, the more likely you are risk of getting diabetes. So
You see, when you catch there, but you throw it, catch it, you magnify
exactly. Exactly. It's very. I mean, I have heard of some people eating wheat. You can make wheat into like a swallow. You can make your soup. You can see in your soup, your okra and all that. Just don't put any palm oil or anything into it. So if you make okra,
palm oil,
don't. Yes, people put palm oil into food. Yeah,
ladies and gentlemen, I think I need to bring Dr. Wasi back. I need to negotiate with Dr. Wasi for Dr. Wasi to come back, because this palm oil issue and whatever oil and food that we are trying to cut down, I think I need to negotiate and bring her back.
Yeah, just cut that lifestyle change. That lifestyle changes usually solves a lot of things. So if you eat good food, you drink water, you cut out on the soda, you cut out on the sugar, it's most likely to prevent type 2 diabetes. Type 1 diabetes, maybe not, because sometimes it's nothing, you can't, it's not your fault, basically. So that's a different story for another day. For type 2 diabetes, you know, it's not something that you can just get off somebody, but if there's a strong family history of it, and you know, there's obesity, and it's, you know, the very bad diet, you know, unfortunately it happens. But if we can have good lifestyle, we can prevent it from happening. And if you do have it, and you have a good lifestyle.
Yeah.
Yes, it's all about the lifestyle. It's all
about the lifestyle. Wow.
Yes.
Ladies and gentlemen, this is Life Train. My name is Patrick, and you are on PatMac Radio UK. If you are traveling to Africa from anywhere in the world and you need help when it comes to booking your ticket and your COVID certificate, you can call PatMac Travel Helpline. We are just the helpline to help you normalize your travel certificates, so that when you get home, you will not find any problems. You will just go through the queue without spending time out of your tired travel. You can call 07578 943 746. If you are calling from outside the UK, don't forget to add 0044 to it, or you can email info@patmacgroup.inc.com, and then we will sort you out. Just a small service charge. And if you live in the UK and you need cleaning services, even if it is in your office, in your industry, wherever the cleaning services may be, in your house, you can call PatMac Cleaning and Facility Management Limited, and then we will come and sort your cleaning for you. You can visit our website, www.patmaccleaningltd.com or info@patmaccleaningltd.com. That is their email. You can call them 01234, that is Bedford, 01234 932 202. If you are calling, well, you should be in the UK before they can help you. So you need to call them at any time. Ladies and gentlemen, we'll be speaking with Dr. Wasi, and I will make her say something last before we finish the show. We are going over our time, but I will just make her give her final word to us before we finish the show. But I promise you, she's a busy woman, but I am going to renegotiate with her and then bring her back to the show so that we'll talk about health. It is important that we talk about these things, because we cannot die and leave purpose hanging. We cannot die and leave the children in limbo. We cannot do that. So we must sort out our health, and then we would live and fulfill purpose, as we have been always saying. Dr. Wasi, what is your advice to my listeners?
Lifestyle changes, very important.
Cut the fufu.
Cut the fufu and cut the carbohydrates. Reduce them at least by 70% to start with. So start small, and then you gradually, you know, up it from there.
Wow. Thank you very much, doctor. And then I think this one, I will let you know that I'll be coming back. I'll be
No
coming back
problem.
to renegotiate a day that we
I'll be
can
happy to
talk.
be back. And then we can talk about
Thank you
diabetes,
very
because
much.
that's very,
Sure.
very common.
Yes, yes. Thank you very much, Doctor. Thank you. Thank you so much. So, ladies and gentlemen, this has been Live Train. My name is Patrick. And then after this show, you're going to be hearing good music. You're going to be hearing a lot of good music. Stay tuned. Do not take your dials away. Enjoy the music. Happy yourself. And then your life will never be the same. Join me next week, same time, and we will come your way with Live Train on PatMac Radio UK. Thank you very much. Yeah, Doctor.
Yeah.
Yeah, we are off there.
That was a very good show. That was a very good show. Well done.
Let me